My Safety Training Online presents HAZMAT for Healthcare, Operations Level Course, Decontamination, Disposal, Documentation. What you will learn. We'll discuss proper disposal procedures, proper decontamination procedures, proper documentation procedures, how to properly apply standard operating procedures, proper handling of victims' equipment during an incident, and proper handling of personnel during and after an incident. CIA stands for Command, Identification, and Action Plans. PCP stands for Protective Equipment, Containment Control, and Protective Actions. DDD stands for Decontamination, Disposal, and Documentation. HAZMAT objectives: removing or neutralizing contaminants using properly trained personnel and using the right equipment for HAZMAT situations. The primary decontamination is done at the scene. Secondary decontamination is done post-incident, and emergency decontamination is normally done by first responders. The number one problem is preventing the escalation of the problem. Exposure of toxins. It might be on you as a first responder. Contamination. It also could be on you if you do not control your exposure. Part 2. Handling the decontamination. The dirty details. Assessing the extent of self-contamination. What amount of material fell on you? The length of time that it's on you, the concentration of the material, the physical state of the material, and the ambient temperatures of the area in which you were contaminated. Handling a self-contamination. Anytime you can suspect contamination, the material should be visible to you, or a victim complains of pain, odor, etc. A victim was on or near the release of the contaminant. Handling self-contamination. People and equipment and decontamination require accounting for the victims, getting the responders, using the right equipment for the situation, and protecting structures whenever necessary. Steps in decontamination. Who usually does decontamination? FROs, or first responding officers, who are properly trained in equipment. FRR stands for First Responder Operations, techs, specialists, via decontamination teams. How to decontaminate? There are no absolute methods, but we do have some general guidelines that we'll offer you. Steps in performing a self-decontamination. The first step will be the physical removal of the contaminant, the chemical remover, or the emergency decontamination of the individual and situation. Procedures to follow in logical order go from dirty to clean. Check your emergency action plan for what procedures you want to follow. The summary of self-decontamination means the purpose is to prevent the spread of contamination, keeping the event from getting any bigger. When it is done, any time that contamination is suspected, what happens? People or victims or responders and equipment are involved. How? Only general guidelines are based on factors of the event. There are no absolute standards. These things may vary from event to event, but should follow a logical order. Part 3. Decontamination and no action consequences. The consequences of no action. Acute or chronic health effects could get worse, resulting in possible death. Anytime you suspect contamination, use common sense. Assess the life risk. Assess the level of exposure. Emergency decontamination situations. Use a copious amount of water. Copious equals more than you have used in the past. Remove all clothing from the victim, including undergarments. Precautions. Avoid contact with clothing. Ensure the privacy of the victims. Construct barriers with temporary garments. And segregate by gender. Medical considerations must be weighed, and the decontamination prior to transport of the victim. Protect the equipment from contamination and segregate contaminated material. Here you can see a diagram of a patient decontamination procedures. Part 4, Sequence of Decontamination, Workstations for a Small-Scale Event, involving between 1 and 5 persons. Patients arrive. Time to activate the plan. We have an event occurring, the patients arriving with or without notification. We activate the disaster plan and prepare staff to receive patients. Triage events in decontamination. Triage patients arrive on a small event of 1 to 5 persons. A triage is defined as a process for sorting injured people into groups based on their needs for or likely benefit from immediate medical treatment. A triage is used in hospital emergency rooms, on battlefields, and in disaster sites when limited medical resources must be allocated. Steps to decontamination when no contaminants are present. The patient is taken to the treatment area and then next collecting their personal belongings or evidence, redressing the patient with clean covering, reassessing and treatment, and then release. Steps when a decontamination is required. Activate the hospital decontamination protocols. Collect the personal belongings of the individuals, as well as any evidence if applicable. Secondary triage, or process for sorting injured persons into groups based on their need to benefit from immediate medical treatment. Lastly, undress the patients. The patient will be able to perform self-decontamination after undressing. Assistance or medical treatment may be required by the patient. If no assistance is required, the patient is directed to self-decontamination. At this point, after the patient has been processed, treated, the administrator must assess the adequacy of the decontamination. If contaminated patient needs assistance, then provide assistance and/or treatment within hospital capability. Decontaminate the patients. Assess the adequacy of the decontamination. Assessing the adequacy of the decontamination means the administrator has a comprehensive list of what to look for, and then deciding if they have been adequately met or not. If the treatment was adequate, then it's okay to redress the patient with clean covering, reassess and treat, doing a disposition or disposing of the patient. Part 5, Management of Contaminated Patients. Here we can see a graphic of patients entering into a hot zone or exclusion area or dirty area, where they are confronted by the decontamination resource team, the decon unit initial contact leader, the triage unit leader, the stripper or bagger, and contaminated patients. Then you have shower 1 and the tub 1 warm zone area, followed by shower 2, tub 2, and the patient's exit to a cold zone or support area, occupied by decon resource leaders, dryers, dressers, gatekeepers, admittance in uncontaminated patients. Hazardous materials group positions. HAZMAT group leader is number 1. The technical reference is number 2. Site access control is 3. Decon leader 4. The entry leader is number 5. And number 6 is the assistant safety officer, who reports to the safety officer. Here we have a graphic showing the HAZMAT decon resource team. Part 6, handling a mass decontamination. Here we have a picture of a fire department HAZMAT team conducting mass decontamination procedures. Here's a picture of a fire department conducting a HAZMAT training session. Here's a picture of a mass decontamination situation that is hospital-based, conducting a training procedure. More pictures of a mass decontamination training procedure conducted using hospital-based procedures. This is the patient area that has been cordoned off. Here we can see where a victim decontamination facility is based on the circular drive in front of the medical center. Are routinely used as a break area, but during an emergency can be the site of a decontamination unit. Here you can see a gender-based situation where the male-female ambulatory decontamination lines are separated. Here we can see where a standard break area has been converted to drop-down sprayers with a final rinse of the ambulatory and decontamination of non-ambulatory victims. Here's an off-on box and mixing unit for the shower, which of course emergency personnel would be trained in how to use. Here we can see a fully deployed shower with the shower lines for the ambulatory victims and the disrobing area for ambulatory victims. Here you can see the former break area, which is converted to an ambulatory men's shower line. Here you can see a simulated decontamination of a non-ambulatory victim. Part 7, detailing the documentation part of HAZMAT. Disposal requirements for contaminants collected. The strict legal requirements under RCRA or RCRA require it to be tracked from cradle to grave, and you must know them and follow them. Regulations apply to government agencies also, you know. HAZMAT organizations need to get a better handle on HAZMAT problems after effects. The role of the first responding officer in documentation is key. Capturing the key initial information and using the ICS Form 214. ICS stands for Incident Command System and is available at the FEMA government website. Reasons for documentation include cost recovery, exposure records, training records required by OSHA, and future lawsuits and investigations. The components of documentation include the date, time, and location, the names of all responding personnel, and the exposure times of each of those personnel, incident conditions, observations, and statements, chemical names, weather conditions, release factors. Documentation also includes the actions taken, the resources used, the costs incurred, casualties, sample data, as well as statements and observations of witnesses, diagrams, photos, video, samples. Remember, keep your exposure records for at least 30 years. All responders should keep their own copies as well. Chemical exposure records should have the date, time, and location of the incident, the chemical name, the type and concentration and duration of the exposure, decontamination or medical aid that was given to those affected. Environmental concerns, post-event monitoring, working with state and local federal agencies, air, water, and soil and ground monitoring, personnel, respiratory monitoring, chronic and acute exposure and after effects, as well as chemical exposure records for files, all part of your HAZMAT discussion, and post-event monitoring. Part 8, Summary of HAZMAT for Healthcare. The role of the first responding officer is to safely and competently respond with an appropriate response level. based on the level of the emergency and using appropriate resources and capabilities. There are 12 essential tactical operations in a safe, competent hazardous materials response. SIN. Safety first in approaching the situation, isolating and denying entry to those who do not belong in the area, notifications of appropriate personnel. When clues indicate possible hazmats, be cautious when approaching the situation. Approach upwind, upgrade and upstream, at a safe distance. Use natural barriers and avoid vapors and liquids. Do a safe size up. Identify the primary safety concern. Position vehicles headed away from the event. Deny entry via a safe entry point. And stop at visual sightings. Use binoculars and do safe sizing up from appropriate safe distance. Establish a secure perimeter. Make mandatory notifications and request aid. Keep unnecessary people away. Remember, command identification and hazard assessment is necessary, along with action planning. The first responder should assume temporary incident command and maintain initial CP in a safe area. Begin immediately dangerous to health alert with a NRG, Emergency Response Guidebook. Verify with 3 sources and brief incident command at the incident post. Follow an incident action plan which has backup plans. Observe a perimeter and control zone and stay in a staging area if no mission and you are not released. Personal protective equipment should be suited to the situation, using containment and control of the problem. Protective action should be taken against the problem using appropriate protection and monitoring for flammable and explosive vapors, using agreed upon emergency signals. Remember, document, dispose, and decontaminate. Keep good documentation as recommended and expose your records for 30 years. Keep essential communications clear. Consider teamwork essential and coordinate with all responders.